Imagine a virus so ancient, it's been hiding in human DNA since the Bronze Age. A virus that's traveled with us through migrations, empires, and even the rise of kissing. Today, we're unraveling the origins of herpes simplex virus 1, the culprit behind cold sores, and how it became a lifelong companion to 3.7 billion people. Let's rewind the clock 5,000 years. When the oldest herpes genome ever found in 2022, scientists cracked open a genetic time capsule. By analyzing ancient teeth from Russia, England, and the Netherlands, they sequenced the oldest herpes genomes ever discovered. The oldest? A 1,500-year-old man from Russia's Ural Mountains. But the story doesn't stop there. According to Dr. Christiana Scheib from University of Tartu, every primate has herpes. But the modern strain plaguing us today? It surged around 5,000 years ago, right as humans began migrating en masse into Europe from the Eurasian steppe. But what happened in the Bronze Age boom? How herpes went viral during the Bronze Age, steppe migrations triggered population explosions. More people, closer quarters, perfect conditions for HSV-1 to thrive. But here's the twist. Herpes might have hitched a ride on a new cultural trend. Kissing. Dr. Lucy Van Dorp, UCL, says, romantic kissing, first documented in South Asia, likely spread to Europe during these migrations. Suddenly, herpes had a fast lane for transmission lips to lips. But before kissing? Experts think herpes spread vertically mother to child. But Bronze Age intimacy turned it into a global phenomenon. A million-year-old virus with a modern makeover. Herpes isn't new. Its roots go back 6 million years older than Homo sapiens. But the strain we know today? It's a relative youngster. And here is the key fact. When comparing ancient herpes to COVID, we find intriguing differences and similarities. Both viruses have affected humanity significantly. Ancient herpes has existed for centuries, whereas COVID emerged recently. Understanding their histories helps us grasp their impacts. Ancient herpes spread through close contact, while COVID-19 transmission occurs via respiratory droplets. Studying both viruses reveals how societies respond to health crises. Each outbreak shaped public health measures and awareness. Ultimately, both viruses remind us of the importance of vigilance and research in disease prevention. While COVID mutates rapidly, herpes evolves slowly. It hides in nerves for life, changing minimally over millennia. As per Dr. Charlotte Holdcroft from Cambridge, herpes is a master of stealth. Studying ancient DNA lets us see how it shaped and was shaped by human history. Why herpes was so hard to find. Finding ancient herpes is like searching for a needle in a haystack. Researchers screened 3,000 archaeological samples, only 4 had HSV-1. The victims are from a 6th century Anglo-Saxon woman, a 14th century man with agonizing dental abscesses, a 1672 Dutch pipe smoker killed in a French attack. According to Dr. Sarah Inskip, University of Leicester, discovering herpes in medieval teeth was unexpected. It shows how ancient DNA can rewrite medical history. Even Roman Emperor Tiberius tried banning kissing in 1st century Rome due to rampant cold sores. But it didn't work. Love, it seems, always finds a way, even if it means sharing a virus. But why this matters today? As HSV-1 now infects 60–95% of adults globally. Most carry it silently, but outbreaks can be devastating for the immunocompromised. Understanding its past helps us predict its future. Next time you feel a cold sore brewing, remember, you're part of a 5,000-year-old story, one written in migration, kisses, and the unbreakable bond between humans and viruses. Thanks for listening. For more tales of ancient plagues and modern mysteries, hit the subscribe button. Stay curious.